The South African National Blood Service is appealing to the public to donate blood and boost blood supply ahead of the Christmas weekend. The SANBS says stock levels are currently at a critically low level. The organization's lack of access to schools, universities and many corporates during the holiday causes a decrease in blood donations, while the usage of blood in hospitals only decreases slightly. The SANBS says while the slight decrease is due to fewer elective surgeries that take place, all other required blood transfusions continue over this period. The organization has warned that it will not be able to fulfill all the requests received by hospitals if blood donations do not increase. Right, to speak a little bit more about this, we're joined now by SANBS Medical Director Dr. Karin van Berg. A very good evening to you and thank you so much for speaking to us. It's terrible to say this, but it seems like almost every festive season you find yourself in this situation. Is there anything that you can do to avoid this?
So we have in the past really looked at our operating model, and we have pre-COVID actually succeeded in creating a system through which we were able to get through the festive season without running into these serious demands. The unfortunate situation with COVID is that the combination of the limited access to our blood donors, in combination now with this wave, the continued high demand on blood has just really made it almost impossible for us to be able to meet this demand for the country. At the moment, we have the added problem that our regular donor base are on leave, as many of us are, and which means that people are also less likely to take time in their day to come and donate. So all of these things together have just conspired at this particular point in time that even the really great business models that we have implemented over the last couple of years have not been able to make our system be sufficiently robust to be able to meet the demand at this stage.
Is there a certain amount of blood that is required for a period like this? And is there a way to stop? I know it's very difficult to stop our blood, but is there a way actually of just trying to mitigate it?
Yes, I mean, technically it's really difficult. Some of our blood products, for example, platelets, only have a 5-day shelf life. So, that is even less than lettuce. And anybody who looks after lettuce will tell you it's a really difficult product to manage. So for us, products such as platelets, we have, we collect it on day one, and you have to then test it and make sure that it is safe and then distribute it back. So essentially the product actually only has a 3-day shelf life, which makes stockpiling really difficult. Now, red cells have a higher shelf life or a longer shelf life, but as I've indicated, compared to, for example, December 2019, our blood donor base has shrunk by 20%. And this is the result of all the different impacts that COVID have had on us. So we've been trying, we saw this coming, this didn't hit us as a surprise, and we really tried our utmost best to, as you say, try and stockpile some of the red blood cells. But, the last couple of months since the last wave, there's been a really strong demand for blood beyond what we thought would happen. And I think has a lot to do with the backlog of healthcare that we've seen over the last couple of months. And the doctors and the patients now are using this period to get all of the work done that maybe was not done, earlier in the year. And so our very best efforts at trying to stockpile the blood has been thwarted by the fact that the demand for blood coming into the festive season has been at near record highs. And so all of that, unfortunately, just left us in this really unbelievably difficult position that we are in.
Do you have
now.
any intel as to why it is at near record highs? And what would you characterize that as for those of us who don't have the know-how in terms of the levels, the liters of blood that is required during this period, and obviously from individual to individual?
So on average, for the South African National Blood Service, which we supply all of the provinces except for the Western Cape, we look at issuing about between 2,500 and 3,000 units of blood every single day. And so over the last couple of months, we've been regularly hitting the 3,000, if not more, units a day, which has been significantly higher than what one would normally do over this period. I think one of the other things that happened is that the impact of COVID has been that our normal utilization patterns have completely changed. So we know from a lot of historical data that certain months of the year we use less blood. Often over school holiday periods, there's a slight decrease as people go on leave and they don't do elective surgery. But those patterns, which we have become familiar with over the last 10, 15, 20 years, have been completely dismantled by COVID. And so the only thing that we have to go on now is what we have seen over the past, almost 2 years now. And we see that especially right after a COVID wave, we run into trouble. But with this particular COVID wave, because the patients are not saturating, the COVID patients are not saturating the hospital beds, we have ongoing elective procedures, ongoing trauma cases, which means that there's ongoing treatment of our cancer patients, which is really important and are very big users of blood.
I am going to ask you
so
a few questions in tandem. Because you've just given the reply that you have. And one, which I find quite intriguing, you say you support all the provinces except for the Western Cape. I want to know why. But secondly, just talk to us a little bit more about how COVID-19 has impacted on the patterns, the trends, especially for supply and demand.
Okay. We have a sister company, the Western Cape Blood Service. They supply the Western Cape, and that there's a historical a precedent for that. But we work very, very closely together. They are also experiencing pressure on their blood supply. And so we want to, even the people in the Western Cape, to please go and donate blood. Because we look after each other, the two blood
and not
services.
to derail you, Dr.
Certainly
Karin,
do.
You say there's historical precedence. What is that? It's just a very interesting fact. I've never really come across it.
So some 20 years ago, the various blood services amalgamated, and at that time, the Western Cape, this is way before my time, but to my understanding, the Western Cape Blood Service at that time were still investigating amalgamating with the rest of the blood services. And so, not to get derailed onto that, we work very, very closely together. We have multiple meetings together. And so, the only thing I can add to that is that we certainly support each other very well.
It's just an interesting nugget. So let's move along then. COVID-19, how it's impacted you and the way you do business. And if you could also just tell us a particular blood type that will help alleviate this. So if you're calling for donations, which blood group would you encourage to come forward? So
usually, and which is also the case at the moment, Group O blood is really what we desperately need. So Group O blood we can issue to almost any patient. And so those are the blood products that we keep in our emergency fridges. if we have patients that are bleeding actively and they can't wait for the normal cross-match testing that we do, we are able to issue them with a Group O blood, and we know that that would be safe. And so from that perspective, we call on especially our Group O donors, but quite frankly, at the moment, we want everybody to come. As for the impact of COVID, the COVID impacts obviously our staff. They live within the normal South African society, and so they are also exposed to the virus just like everybody else. And so we have staff concerns like many other organizations do. But also every time we have a COVID wave, there's a whole number of our donors who are affected either in quarantine or in isolation, and so they can't come and donate. Others are fearful of coming out into the public arena. But then, as you indicated at the start of the segment, that access to our donors through some of our traditional collection methods, such as big corporate campuses, university campuses, schools, and so forth. Either people are limiting our access to those venues, or when we do get to go there, a lot of the people will be working from home. And also when we are there, we take the security or the safety of our donors very seriously. And so we implement very strict measures to protect the donors, which means that each collection takes a little bit longer because we clean everything before the next donor starts. We make sure that we implement social distancing, and all of those measures actually impact in our ability to collect the same number of units that we would have been able to collect pre-COVID.
Thank you so much for taking the time to speak to us. Really appreciate it.